Hello and welcome to the first of 4 educational mini-series programs provided by the Berks County Area Agency on Aging. My name is Ann Barlet and I'm the Community Education and Outreach Manager for the agency. Our first series is on retirement planning. We will have 4 separate segments and they will focus on understanding Social Security, the eligibility and benefits as it relates to retirement. The second program will be on navigating the Medicare system. Another program will be on financial planning, counseling, and our fourth in the series is on estate planning. I would like to welcome our guest today, Dot Hartman. She is the Vice President of Community-Based Aging Services and the Apprise Coordinator for Berks Encore. Welcome, Dot, and thank you for being here.
Thanks, Ann.
Our program today, as I mentioned, is going to be on navigating the Medicare system, and it's quite, I need somebody to help me navigate the system, so thank you. And what we're going to be doing is, let's start with just the simple basic facts. What is Medicare? How do I get it? And when do I get it?
Well, that's a lot in one question, Ann. So Medicare is the federal health insurance program for persons ages 65 and older who are legal residents of the United States for at least 5 years. You can also get it at a younger age. If you've been collecting Social Security disability for at least 24 months, then you are automatically put on Medicare as well. It is a federal health insurance benefit, and so it is really the only insurance that's available to people if they're 65 or older and not in an employer plan.
Okay, so what happens? When do I get it? How do I apply? And if you can expand on how does that also relate to, sometimes we confuse that with Social Security.
Right. So when you turn 65, you're eligible, and you actually, are eligible for Social Security at age 62 now for partial benefits. So you can't get Medicare just because you get Social Security doesn't mean you get Medicare. You do have to be at least 65. And if you're signed up to receive Social Security benefits, you will actually automatically be enrolled in Medicare A and B, and you'll get a card in the mail about 3 months prior to the month that you turn 65. So if you're going to enroll when you start 65, you have 3 months prior to the month you turn, the month of, and 3 months after. So that's considered your initial enrollment time. But if you're still working under an employer plan, and that employer has at least 20 employees, then you do not have to have Medicare because you're covered under an employer group plan. And it could be you yourself working or even a spouse that you're covered under. So as long as one of you has employer group insurance, you can use that as your main coverage, and there is no penalty for not getting Medicare when you turn 65. You do want to get it as soon as you stop working. You actually have 8 months to sign up when you get out of an employer group plan. Most people want to do it right away because they don't want a gap of coverage.
Right, that's what I was going to say. So I'm okay, I don't have to enroll right away at 65, even though my age makes me eligible if I'm still working, and as you mentioned, covered with my employer's insurance plan.
Right.
So in anticipation of retirement, an age that I might retire when we're retiring later and later, so let's just say I'm going to retire at age 68, and you said I have a period of time. How far, so I really can't do a whole lot, is that what you're saying? At 67, I only have really the 3 months opportunity before 65, so at any time, if I'm looking ahead to retire at, say, 68, when should I start to figure out, oh my gosh, now I'm going to need something, and I don't want the day I stop my employment with my employer and that coverage ends and not have anything or a gap until something
Medicare
should be selected.
Right.
So yes.
Yeah, so Medicare always starts the first of the month. So that's one thing. If you're going to retire mid-month, you want to talk it through with your employer. Are they going to cover you to the end of the month, or do you need to start Medicare at the beginning of that month? And then what you need to do is contact Social Security. If you're trying to sign up after your birth, the 65th, the month you turn 65, then you do have to contact Social Security and let them know, okay, I didn't start it yet because I was still working, but now I want to start. Because there's a 2-part process, a form that you fill out, just giving them your information and when you want to start, and then a form that you'll take to your employer and they'll fill out what coverage you have had to prove that you've been covered.
Okay.
Because if you don't start at 65 and don't have anything, then there is a penalty, okay? So they do make sure that you've been covered. So there's the form that your employer fills out. You send them both back together, and you can pretty much dictate which month you want to start. And you wouldn't want to do that, again, before 3 months prior to when all this is happening. And if it happens suddenly, like if all of a sudden you lose a job,
Right.
you know, call right away. They do work with you, so there's no gap in coverage and trying to get Medicare started for you if you're eligible. Obviously, leave, I would say a month is probably the least amount of time that you want to have there, but if it has to happen in a couple weeks, it can.
As long as I'm 65.
As long as you're 65,
Okay.
right. And you can start Part A when you're 65, even if you are still working. That is free to you, so people do that. That way they're in the system and they have a card. So that's really advisable to do, but if you don't do it, there is no penalty.
Okay, so that leads me into my next question then. So I understand my age for eligibility, whether I do have to enroll right away, whether I'm already employed with a coverage or no coverage, and how to do that. So there are parts to Medicare, and I guess I'll ask this question. You know, everybody has a Medicare card. It's that lovely red, white, and blue card. When do I get that, first of all? And then there are parts to Medicare, right? So I think if we start then with you had mentioned Part A or Part B already. So let's talk about the parts then too.
Okay.
So
all right. Yeah, so the card will come to you. If you're collecting Social Security benefits, it'll come to you. If you're not doing that, but you call Social Security and sign up, they will send you a card. Your claim number is the Social Security number that you're getting retirement benefits from. So most likely it's yours if you've been working. If you haven't been, you might be claiming under a spouse. So the claim number would be their Social Security number. And there are effective dates. There's an effective date for Part A, an effective date for Part B. So let's go on and talk about the parts then, if they want to put that up on the screen. We do have 4 parts to Medicare. I've been referencing Part A and B.
And we are ready for this slide. If we can have the 4 parts of Medicare.
And Part A and B are what we refer to as original Medicare. They've been out the longest. So Part A is what covers your hospital stay, really your room and board. And it is, I think I mentioned, it is free. We pay to that through our FICA taxes from our employers. So if you worked at least 40 quarters, basically 10 years, you have contributed enough to get Part A for free. And it's a benefit that if you haven't worked enough, you would have to pay like $465 for a month. So it is a big benefit. So we're getting that part for free. And with Part A, you get the hospital stay, your room and board. You would have any blood that's given while you're in the hospital. Hospice comes under Part A, so care that you would need at the end of life is under Part A.
And I know that you can be on hospice services in the hospital, but also in your home. So if you are on hospice services in the hospital, that's Part A.
Either place.
Either place.
All
Okay.
of hospice
All right.
is under Part A.
Very good, thank you.
And the other part that's under Part A is if you need skilled nursing facility care. So if you have to be in-house in a skilled nursing facility for therapy, it is a qualifier that you have a 3-night hospital admission prior to that, though. So make sure that you have that 3-night qualifying stay, and then you get 20 days for free covered by Medicare Part A in a skilled nursing facility. And that's as long as you're there getting therapy and improving and looks like you're going home. Yeah, it's not, you know, if you're there and they deem that therapy isn't helping you and that you're really not going to become mobile again, and so you just maybe need to stay there for long-term care, then Medicare stops paying for the room and board. They're only going to pay as long as you're there getting therapy and improving.
Okay.
The other thing under Part A is if you do need home health care following a hospital stay. So like they send you home and they send a nurse to come out and look after you, and that is all covered in full for that. And obviously that has to be doctor ordered.
And a period of time, I
right,
assume, a
right.
certain number of visits or a period of time.
Following
Okay.
that hospital stay, right?
Okay.
So that's Part A. And then
All right, let's
Part
go to
B is pretty much everything else except for drugs. Part B is going to be any outpatient services, doctor visits, x-rays, lab work. It's durable medical equipment like hospital beds, wheelchairs. It is covers the ambulance if you needed to take an ambulance to get to the hospital. Therapy, the outpatient occupational physical therapy is all covered under Part B, as well as, again, home health care. If you're homebound and can't get to a doctor's visit, they can actually send a nurse to you to have an appointment under Part B. And then the other part that Part B covers is any blood used or drugs in a facility. So if you're getting a flu shot, even though it might be at the pharmacy, it's not something you're administering yourself. So any drug that has to be administered by a doctor or nurse is covered under Part B as well. And so that's any drugs that you would get in the hospital. And with Part B, we do pay for that. So that this year it costs $104.90 a month. It tends to change most years. We've gone a couple years here without it changing. It cannot go up any more than the cost of living increase for Social Security benefits. So it can't be raised percentage-wise any more than people are getting in Social Security. So we pay $104.90 for it. Most people do. And then there's a deductible. This year it was $147 for the year, so a relatively small deductible. And then after that, Medicare pays 80% and the consumer would pay 20%. And I think I failed to mention with Part A, there's also a deductible for that hospital stay of $1,216 for a stay. And then if you're there more than 60 days, there's some co-pays, but hopefully you're not there more than 60 days. All right, so that's A and B.
All right.
D is obviously the drug coverage, and that is a separate premium, and those drugs then have co-pays. Sometimes the plans have deductibles. And then I'll backtrack into C, because C is really, you either have A, B, and D, or you have C. So C is an option. Okay.
All right.
C is a different way of getting original Medicare. And when you have a Part C plan, you're going with a private insurance company, and those are HMOs and PPOs that people are pretty familiar with. So if you ever see HMO or PPO, that means you have a Medicare Advantage plan, and that company is your primary insurer. They now have the responsibility to give you Medicare-like benefits through their plan. So when you have a PPO or an HMO, you'll be told you don't ever show your Medicare card. Because even though you have that, they will not get rid of it.
Supposed to have coverage A and B,
But you have that coverage through this alternative plan. And oftentimes they usually include drugs, and sometimes they give you preventive dental and vision, hearing, that type of thing. So they can give you some extra things that original Medicare doesn't. And in Part C, sometimes you have deductibles, but more likely you don't have that 20% coinsurance. What you have is a copay for things that you do, for a doctor visit, for a hospital stay, for blood work. You do copays with the Part C plans.
So I think the logical place we understand each of the segments or the pieces of Medicare overall. Let's look at, you were talking about costs. So let me find that slide and we'll go to that one. Okay. Can we get that slide up? It's the 2014 Medicare costs, and look at it again in a different way, talking about Part A, Part B, Part C, and Part D. So again, if you could review that with us, with each of the parts, so Part A, we're looking at those costs that are associated with the hospital stay that we talked about. So can you share that?
Right, again, so with Part A, if all you have is original Medicare A and B, you would be responsible for the costs that are showing on this chart. So you would have a deductible for a hospital stay, and that is actually a 60-day benefit period. So if you're in and out within 60 days, it's really only one benefit period, and you would only pay that once. But if you're in January, and then May, and then September, that would be 3 separate stays, and you would have to pay that each time. And then if you're in beyond 60 days, it's $304 a day. Skilled nursing is 20 days in full, but after day 20, it's $152 a day. So there's definitely a co-insurance there. Part B, you have the premium, you have the deductible, and then the 20% for the co-insurance for Part B services. Yeah, so since, they don't cover everything, and for seniors on a fixed budget, that can be a little
Yes.
daunting.
Yeah.
So there are ways.
I'm adding in my head already, okay,
Yeah.
divide that. Divide the per year deductible kind of and have your budget for that plus the per month premium, and then you've got some of your co-insurance information, so. Okay.
Yeah, there's some heavy costs there. So there are ways that we supplement it, which makes it even more complicated, but we'll get to that next.
And then, you mentioned earlier, so make sure I'm correct on this, that we would have Part A, Part B, and Part D.
Right.
So now we're going to add, let's talk about Part D with that too,
With
while
that,
we're
right.
on that same.
So then you want to add in your premium for your Part D plan. And this year, the lowest cost plan was $12.60 a month. So for people that didn't have any drugs or maybe just had generics, that was, pretty reasonable coverage. It went up to $169. So, theoretically, the higher the premium, the lower your copays will be for your drugs. That's not always a direct correlation, but obviously if you have some expensive preferred brand name drugs, you're probably going to have to pay more in a premium for your plan. And the nice thing is that using Medicare.gov, it figures that all out for you, so you don't have to guess. So if you put your drugs in, it'll tell you exactly what every plan will cost, and you get to compare them cost-wise and benefit-wise. Some of the drug plans have deductibles, some don't. And then we have the coverage gap, the donut hole.
Okay. Yes, we've all heard about the donut hole.
Yeah, it is going away slowly. By 2020, it will not exist. And so this year, the coverage gap is basically a different level of coverage. Once your total drug costs get to $2,960, then you get to pay more for brand names and for generics. And so there's this period of time when you have to pay more for the drugs. This year it was that you actually paid 52.5% of the brand names. Right. Next year it's going to be 45%, and it'll go down each year until we get to 2020. The same with generics. This year we paid 28%. Next year it'll be 35%. So they are eliminating the coverage gap through the Affordable Care Act, but it does exist. A small percentage of people fall into that, but if you fall into it, it hurts. Because it's when you've spent already a lot on drugs and now you have to spend even more. So it's a real thing, and for people coming off of employer plans, it can be a big sticker shock.
And yet we still need the coverage for medications because
it's still cheaper than paying for it out of pocket.
Okay.
Yeah.
And now, or we have Part C of Medicare, and then if you can review those costs to us for Part C, and then we'll go to the other screen for how it's divided.
How you can supplement, right. So Part C that's a substitute for Medicare, but you don't get away from having to pay that $104.90. Regardless of how you supplement Medicare, you still pay $104.90, and usually, I don't think I mentioned it, but it comes out of your Social Security benefit if you're collecting Social Security. If you're not, they'll bill you for it, but
they'll get it.
You still pay $104.90, and then you pay an additional premium for a Part C plan, and they vary. You can get one actually for $0, which means you're not paying anything in addition to the $104.90. This year it was up to $219. Next year I think the highest plan is $296. So they vary, and again, obviously, the higher the monthly premium, the lower your copay should be. The more added benefits you get, maybe the more dollars towards hearing aids or dental kind of thing, and the more expensive plans. So you get to choose there. And in Berks County, we have a huge variety of plans. I think we have like 56 total plans to choose from. So it's all within maybe 5-6 companies, but they all have different options. Some of them have deductibles, and of course the copays are going to vary in what benefits. Part C plans are supposed to give you benefits at least as good as original Medicare, because hey, guess what? You're paying that $104.90, and the government is giving your Part A to your plan. So you shouldn't be any worse off, but they get to choose and pick where they want to give you the additional benefits. So it's up to you to really look at that, and every year they'll change, so you want to keep on top of it.
And what I'd like to say now, and we'll cover it again at the end, but should you be preparing to begin to enroll, or need to make changes, or starting to think about this and have any questions, or working or helping somebody else, to make sure that you can contact Dot Hartman at Berks Encore at 610-374-3195. Ask for an apprised counselor so that you can have an appointment to sit down and actually look at those various plans, coming in with some prepared information to provide, and we'll cover that a little later as to what they need to bring with them, so that you can sit and look at some of the plans to make sure that you get a good coverage for what your needs are, and make sure that you're doing it with a good amount, that you understand the costs involved for that.
Right,
Okay.
right.
And I think we'll do one more, just to make sure that we still, just to kind of wrap up one more thing on our coverage choices, if we could put that slide up. Again, I'm just going to reiterate and have you reiterate the two ways of that
Of getting
for us,
coverage.
if you
Yeah,
would.
this is really the crux of understanding Medicare and how you're going to do your coverage. There's two ways you can go. On the side that says Medicare Parts A and B, that means you stay with original Medicare, you pick a drug plan to get your drug coverage, and then you get a secondary policy or a Medigap plan. And those Medigap plans can cover the deductibles for Part A and B, as well as the Part B coinsurance. You have a few choices there, but basically you're deciding, which deductibles you want covered, and if you want all of the coinsurance covered. So you're still keeping Medicare as your primary, which means you can go any place that takes Medicare, and then you have the secondary plan that, based on the standard plan, and they're the same. Whoever sells Medigaps, if they sell Medigap Plan F, it's the exact same thing as another company's Medigap Plan Fs. The Medigap plans are standardized by the government, so they are all the same. They're just different by company based on your age. They price them differently based on age and where you live.
And is it, excuse me, Dot, is it called Medigap plan? I mean, that's what I'm looking
yes,
for? That's okay.
You want to, people use the term Medicare supplement, but that really can mean either one of these options. So you either want to be talking a Medigap plan to be the secondary to Medicare, or your other choice is the Medicare Advantage, which is the HMOs and PPOs. They put all the benefits into one, so you just have one card, whereas if you're doing Medicare A and B, you have that card, you have your drug card, and you have your Medigap card, so you have 3 versus 1.
Okay.
But with the 3 cards, you really have a little bit more flexibility. With that one Advantage plan, you need to make sure you're going to doctors in the networks that take that coverage. You never want to choose a plan before knowing if the doctors you have accept it or not, or you'll end up paying much more than what the stated copays are. With HMOs, you must use a doctor in their network. With PPOs, you can go out of network, but you pay more, so you really don't want to plan to do that. So the other benefits, or the other distinction I like to make for people between the two options, is that with the Medicare Advantage plans, like I said, they have to give you benefits at least as good as Medicare, but in the high-risk areas, they're really not giving you anything additional. So for skilled nursing stays, most of them give you that 20 days, and then you copay the $150 a day. For chemotherapy drugs, you're copaying 20%. It's giving you the 80% because it's a Part B, you're copaying 20. So Advantage plans are more for people that think, I don't need it much, and so I just want to pay as I use.
At their current state, when they're evaluating it, that's what they're saying.
If they're healthy, they're thinking, I only do a couple doctor visits a year, I can pay as I use. With going with original Medicare and a Medigap, you're going to pay a higher premium, but then everything's covered, and including that 20% of the chemo drugs, including 100 days in skilled nursing. So that's for people that want to just pay and know they're covered, regardless if they use it or not. They're risk averse. Advantage plans are more for people that don't want to pay for insurance they're not going to use, and then they pay as they use. And there are max out-of-pockets on the Advantage plan, so you do still have some protection.
And everybody is unique and individual in where they are currently and as they age.
Right.
And also the fact that they're looking at, I'd be looking for myself and not for anybody else. So each person is different, and that's why we need to consider it for ourselves and not try and share and compare with others, because they have different circumstances, different needs, different medical issues, different medications. So it is key to really sit down and talk to somebody specifically about what you're looking for and what your needs are and what the costs that are involved. Okay. So what does Medicare not cover then? Real quickly.
Yeah, Medicare doesn't cover, I think I referred a little bit to the skilled nursing. If you're there for long-term care, Medicare is not going to cover that. It will cover your doctor visits while you're there, and if you're getting physical therapy, but not the room and board. It also doesn't cover dental. It covers only the vision that is related to a medical condition. So if you have cataracts or glaucoma, it'll cover that, but it won't cover a pair of glasses just because you can't see. It doesn't cover, you know, the laundry, the food baking or food making or whatever of a housekeeping kind of instance. It doesn't cover vitamins, mineral supplements, that kind of thing.
Okay, all right, good. We mentioned before that, you know, we can come to an apprise counselor to help us sort all of this out, but another way is really we can get on the computer and look for ourselves, can't we?
Right.
So I'm gonna let's do the next slide, which would be our Medicare.gov homepage, and you can see on the screen that is. Sophie would tell us about, you know, how to access this Medicare.gov homepage and how do I use it?
Yeah. www.medicare.gov is what we use when you would come into our office. There's nothing proprietary about it. It's out there for everyone. And you would want to click on the Find Health and Drug Plans. And if you put in your zip code and your list of drugs, it'll tell you what all the different drug plans will cost you. It'll also look at the Advantage plans and tell you what their drug coverage will cost you. So it's just a wealth of information. There's also a lot of general information there. You can replace your Medicare card. You can, you know, learn about Medigaps. I mean, everything is there. You just, you know how websites are. You just have to,
Navigate.
click and choose and link and
figure them out.
So it really is a wealth of information.
And can I go in and play with it a little bit? Go in and, you know, I don't want to be concerned that as I'm starting to enter some information, that it's going to sign me up automatically or anything like that, right? It's pretty user-friendly to navigate and allow to put some things in the information. And
exactly, yeah. This is, you're telling it your zip code. If you want to give it your personal Medicare ID, it will come back and tell you what you have, which is nice sometimes when you're in Medicare and just doing the annual stuff. I mean, you have to hit enroll. So if you click on enroll and give it your name and address and date, you know, then you will get a plan. But otherwise, yeah, you can't really mess anything up. And it's security-wise, you're really not giving it personal information unless you are choosing to enroll in something.
Okay, good.
Yeah.
And so while, let's switch for just a minute or two, if we can, on the, you know, we've talked about a whole host of what is Medicare, when do I get it, all the parts, the costs of each part, what the parts cover, how to access the information, how to come to you for help. There are now, I'm also understanding that there's some cost savings programs that are related to Medicare. Right? Is that correct? So should we focus on that next? We'll go down to that.
We'll hit on that.
On the cost savings programs slide, and we can talk about that a little bit.
Right. There are different options. The three on the far right that are in the gray, the Part D Extra Help, Pharmacy Assistance, and PACE, all related to drug costs. So PACE and PACEnet is a Pennsylvania program. For any resident that's 65 or older and lives in Pennsylvania, you can use that program. It does not look at your assets, so it's just income-based, so it is a little more easier for persons to qualify for. Then the pharmacy assistance programs are things that the pharmaceutical companies offer. When you're in that coverage gap, they can still help you if you have expensive drugs, and those financial limits will vary by the manufacturer, so we really don't give that. They're typically a little bit higher than the PACEnet limit, so that is still an option for you. And then the federal program would be the Part D Extra Help, and that does look at the assets and the income, so you have to qualify both by asset and income. But any of those programs will help you with that coverage gap. With PACE and PACEnet, you never pay more than $15 a month for any brand name drug, which can be a huge savings to people. With the Part D Extra Help, it's like $660 is the max you ever pay for a brand name drug. So it is a lot of help. The Medicare savings programs, the one helps you if you qualify as a couple, like with $1,770 a month, and the assets under $10,750. That will pay that Part B premium, that $104.90 for you. So that's a nice savings each month. And then if you're a lower income, for a couple with the $1,311 a month, you're actually getting benefits the same as Medicaid, and so then they will pick up all of the costs that Medicare doesn't. So Medicare is your primary, and then this Medicaid will pay for all the coinsurance and all the deductibles for you. So any of those programs we can help you apply for at Berks Encore. You can obviously go directly online yourself, but we're happy to help and to screen. As we meet with people, we kind of screen for these programs, make sure they're getting what they're eligible for.
So that's another good source. If I'm not sure, okay, I can read this and know, okay, my income might qualify, I think, for PACE maybe. Husband and wife might, as a couple, qualify, or for PACE Net. Where does that fit in? So they can come and make an appointment with an apprise counselor at Berks Encore to decipher, do I qualify for this program? Should I need something else instead? Sure. As I'm exploring all this Medicare enrollment and then our changes. So I'm going to move forward again on this and just kind of talk about, we have some of these financial assistance programs through the Medicare program. What's nice is they'll tell you if you're eligible. You can do it online, I see. You can access it individually on a computer or go to a program through Berks Encore. You're not involved in selling any of these. You're not an insurance company. Right. So what you're doing is offering your expertise to folks to help them figure out the best plans, which are the best options, what are the costs of the programs, do they qualify for any of these special cost savings programs?
Exactly, yeah. Okay. Yeah, we didn't really say what a prize was, but a prize is, funded by the State Department of Aging, and it is to give free Medicare counseling and assistance for anybody. So there is no fee for this, and we do not sell anything, first of all, and we're not to be promoting any one plan over another, so it's unbiased information. We hold Welcome to Medicare sessions monthly, so if you're turning 65, come out in advance. We get people a year ahead of time just because they're curious, and that's a good thing because you want to start budgeting for your costs. So we always welcome you to come, and we always have those listed on our website, berksencore.org, or in our monthly newsletter that comes out.
And if we put up the last slide of who can help, that slide has the information that you are giving us as the telephone number of 610-374-3195 and ask for an apprise counselor, or look at go to their website, www.berksencore.org. Anything else you'd like to say on that particular slide? And we kind of have to wrap up our program today. I just wanted to thank everybody for tuning in. We hope that you tune into the rest of the mini-series segments. This, of course, is on retirement planning, thinking ahead, having a little bit of knowledge about where I'm going to be when I'm retiring, what kind of health insurance, how do I get it, when do I get it, what is the coverage, and there's a maze involved in that. So I hope that we've helped a little bit by clarifying some information for you today on that, preparing you to better navigate the Medicare system as you can think about retirement. And we hope that you tune in to the other segments that we talked about at the beginning of the retirement planning series. Thank you.